So, as it is usually described, we all know how painful giving birth is. It is one of the most painful things in this life. So that is why a lot of women come to ask questions about this painless delivery. So what is a painless delivery? This is a delivery that is carried out using an epidural. So today we are going to talk about epidural. What is epidural? So epidural is an injection given to a woman during labor at her lower back. So this is just the simple definition of epidural. It is an injection given to a woman in labor on her lower back to kill pain, for her to have a painless delivery. So how is this injection done? How is it carried out? So epidural injection is carried out by an anesthesiologist. So the anesthesiologist usually will insert an injection at the back of the woman in the space we call epidural space. So that is why it is called an epidural. This injection is given in the epidural space. There are some nerve endings there, and this injection, once it is given, it will kill all transmission of pain into the woman within that region that the nerves carry sensations to. Okay, so what is usually done is that this injection will be inserted, then the anesthesiologist will use this. Usually the place will be numbed. When the place is numbed so that she will not feel any pain, then the injection will be inserted, then a cannula will now be passed through that in order to use that cannula to give the injection. So once that cannula is passed through by the anesthesiologist, that it will be plastered at the back of the woman, and it will be left in place. So this injection will usually be pushed through this means. So the injection of the anesthesia, which is the epidural injection, will be given through this cannula, and it will be left in place till the end of labor. So now the anesthesia has been given, the epidural has been given to the woman in labor. How would she feel? So a lot of women feel differently after an epidural. So some women will describe it as the feeling of like relief. They will not feel any pain again. The only thing they will be feeling is the pressure that comes with contractions, no pain at all. While some will experience numbness, they will feel as if their legs are not part of their body, which is totally normal as well. Then some women will even feel drowsy. Some will sleep off till it is time to push. So a lot of people ask, can I walk after an epidural has been given, like after the insertion of an epidural? It is not advisable to walk because you are at risk of falling, because your legs will become numb, and sometimes you'll not be able to control how you move. So walking after an epidural is given is not advisable. So many times when you feel like you want to urinate, a bedpan will be passed to you to use for urination. So when is epidural given during labor? Is it immediately, like immediately you start labor, or maybe towards the end, or in the middle, or how is it given? So usually epidural is given by the request of the mother. So if the mother requests for an epidural during labor, she will sign and it will be given to her. But anytime during labor is safe for an epidural to be given. Immediately after labor starts, it is safe. During the course of the labor, it is safe. Just that it is not advisable to get an epidural when you've reached 9 to 10 centimeters dilated, because you've technically reached the end of the labor, so there is no point getting an epidural. Okay, so that brings us to advantages of epidural. Why should you get an epidural done? As I mentioned earlier, it will help you in getting a painless delivery. You know that we all know, I myself inclusive, one of the things that you cannot forget is the pain of delivery. It is very, very painful. Sometimes it is described as how is it described, like crashing of bones of the body, stuff like that. Everybody describes it differently. Labor is very painful, even though each woman's experience is different when it comes to the duration and all. So epidural is given to kill all that pain. Okay, another point is that epidural can help in lowering the levels of the stress hormones. Like, when you are in labor, the whole pain and everything, the blood pressure tends to get higher, and there are a lot of things are happening. So epidural will lower that and would help you be in a very calm state. Some gynecologists say that the woman that got epidural during labor not likely to develop postpartum depression afterwards. Some gynecologists even say that epidural helps in softening the cervix to help it dilate faster. Okay, so many people ask this question a lot of times. Like, forget about even getting an epidural for delivery, even during CS. So many people get to ask that. I heard that it causes back pain. It causes back pain, or they hear from their relatives or friends that these injections can cause back pain. Directly, epidural or any sort of anesthesia given in the lower back cannot cause back pain and would not cause back pain for you. So back pain, as we know, carrying the weight of pregnancy over time, and the structure of each woman's body is built differently. So carrying such a weight for a long time, and physical inactivity, staying in one place for a very long time, a lot of factors brought together is what would cause back pain for a woman after giving birth. So on their own, these injections given, specifically epidural, will not cause a back pain for a woman. So we're going to talk about the risks of epidural injection. So number one, a woman that undergo epidural in labor is at risk of getting a low blood pressure because it reduces the blood pressure in the body. Number two, difficulty walking. So another risk associated with epidural is the risk of having an instrumental delivery. So a woman, because of the epidural effect, a woman might find it difficult to push. So we might have to use forceps or vacuum to extract the baby. Sometimes it might cause low-grade fever in the patient, and some patients might experience difficulty in emptying the bladder. So all these are the risks associated with epidural. So when should we not give epidural? So any woman that is on blood thinners should not get an epidural given. Any woman that is bleeding or at risk of bleeding in that pregnancy should not get epidural given. So if the epidural space could not be located, epidural cannot be given. Any woman bleeding profusely or any woman in shock cannot get epidural given. Any woman having an infection on the back cannot have epidural given. So if a woman is having low platelet count, she cannot have an epidural given. If the labor is moving too fast, there is no time to set up for epidural to be given. Also, epidural is not needed to be given. So this brings us to the end of our video. I hope we've all understood that epidural is very, very safe. You can have an epidural. You can read more about it. You can watch YouTube videos. You can search on Google and see and learn and relearn. So it is also very important to note that there is no perfect way to give birth. Whichever way you choose, it is your body and you can do it, and you are meant to do this, and you will turn out totally fine. So don't look down on another woman that had epidural, or don't look at don't look at another woman suffering and say she doesn't know what she should do. We are all different. We are built different. What we are meant to do is different. So do what works for your body. Do what works for your family. Thank you. My name is Dr. ZH Nasiha in another episode of Your Health with You for You.